So good morning, everybody. We're going to discuss transformative potentials in digital health technologies here and the regulatory implications in Africa. These include mobile apps. They also include other digital health technologies, as well as wearable apps, artificial intelligence, telehealth, and how they're revolutionizing healthcare in delivery systems worldwide. Hopefully, we're going to be able to start leveraging these technologies in Africa as well as the rest of the world, and everybody's going to start to be able to play nice, and we're going to be able to start ensuring patient safety and fostering innovation. The objectives of this presentation is going to share frontline experience, discuss regulatory challenges and opportunities, and highlight the role of real-world evidence in digital health and how it's crucial for supporting regulatory decisions, as well as enhancing post-market surveillance and driving adoption in digital health. And hopefully at the end of this presentation, you guys will be able to see and help understand more of the key aspects and how we can all harness the potential of digital health for transforming healthcare in Africa. So let's dive deeper into these points and explore how we can help work together for creating a brighter future for our healthcare. Okay, next slide, please. Can we move to the next slide? Or can I do it on? Oh, there we go. Thank you. So we're going to go over basically global trends. We're going to go over a lot of these have to do with the current digital health technologies. A lot of them recently have to do with telehealth. I'll give you a couple examples that I've done personally with telehealth that had to do with glucose monitors and telehealth and dealing with the FDA, in particularly with a glucose monitor with telehealth, with one you guys have all probably heard with and dealt with that has revolutionized teledoc. AI applications, as well as other systems around that will go through with wearable monitoring technologies. And we will touch base with other platforms with remote consultations and adoptions of these devices throughout. Okay, next slide. Okay, so the case overview, like I touched, would be, we're going to go over two in particular. Case study NUM was a digital health startup in Kenya, and based on IP and privacy, I can't discuss it in particular, but there was a telemedicine platform that was to provide remote consultations. By work closely with local authorities, we helped adopt best practices with international guidelines for the startup to successfully navigated a fragmented regulatory landscape, and we were able to achieve approval for their platform in multiple regions. We enhanced the access to different healthcare services, especially in remote and underserved areas. And the collaboration, we worked closely with local regulatory authorities and ensured the platform met all the necessary safety and efficacy standards, as well as by adopting best practices from international guidelines. So that was US and EU and international forums for the startup to successfully navigate the fragmented regulatory landscape. And so the outcome for this device company was the platform achieved approval in multiple regions. And we were demonstrated how regulatory compliance and innovation can go hand in hand to expand healthcare access. Case example 2 was a wearable health monitoring device. And in this one, the company developed a wearable monitoring device collaboratively with regulatory bodies to ensure through evaluation and approval with their device. And through the capacity of building these training sessions, we were able to improve the regulatory's capacity to evaluate the technology through their understanding and capacity to assess the new technology. So a lot of times we need to work hand in hand with the regulatory bodies as well to help them understand the AI technology, because they are also learning through all of this with us. And the outcome with this partnership was to lead to a faster approval and a broader adaptation and adoption of this device, and showcase the benefits through proactive engagement and capacity of building this relationship through the regulatory process. So in conclusion, by addressing these regulatory challenges, these examples highlight that by addressing regulatory challenges through collaboration, capacity building, and adoption of best practices, companies can successfully navigate the complexities by building digital health innovations into the market. And this in turn can transform healthcare delivery by involving key stakeholders and by setting clear goals. And we can lead projects like this by demonstrating significant improvements and access to healthcare, and efficiency in disease management and patient outcomes. And so this potential for digital health and innovations illustrate potential for digital health to address healthcare challenges, as well as improve patients across Africa and across the world. And this collaborative and innovative approach is essential for sustaining integration in digital health solutions, as well as their healthcare systems. Next slide. Regulatory challenges that we face today are key regulatory challenges faced by companies in digital health internationally, as well as in Africa. And they create significant barriers to innovation, and they affect all of the healthcare landscapes internationally, as well as in Africa. Fragmented regulatory frameworks across the region, key issues that we find, different countries and regions across Africa, across the world, and across internationally, what we're finding are everybody seems to have their own regulatory standards and key requirements as to what's required. In the US, for example, we have the Digital Center of Excellence, which has their own realm. And then in the EU, for example, they just released their new guidance in AI, or artificial intelligence, which is kind of completely, but not completely, diverging from what the AI requirements in the United States are. And so everybody needs to, in my opinion, get all on the same page with respect to what they're expecting for all of us in industry to submit with respect to digital health and technologies across all of our multiple markets. So these consequences for the lack of harmonized standards leads to delays in product approvals and increased costs for industry for lack of cost for compliance. So companies, we need to navigate across this complex webs of regulations, and this slows down our rollouts for innovative solutions. An example would be the digital health startup in Kenya that we've had to work with to closely work with local regulatory authorities and adopt international best practices to achieve approvals for their telemedicine platform in multiple regions. So even though you're trying to get to market in one, if you want to go across multiple regions, if there's lack of harmonization, you have to make sure that you're meeting all the FCC, federal commissions and all the different regulatory telemedicine platforms to make sure that your iOS or Android or, that you comply with all of these verification, validation, and digital platforms so that everybody can talk to everybody. The limited capacity for evaluating these digital technologies, some of the key issues and impacts and consequences. Many of the regulatory bodies lack the technical expertise or the resources needed to effectively evaluate the safety and efficacy and effectiveness of the rapidly evolving digital health technologies. And what I'm finding, and what I'm sure you're all finding, is that we need to teach them what they need to review. The impact is this limitation can slow down the approval process and the limit in the availability of the innovative health solutions. And the consequences are, without the adequate capacity, regulators might struggle to keep up with the technology advancements. And this creates a bottleneck for all of our health technologies entering the market. An example would be a company developing a wearable health monitoring device collaborated with a regulatory body to conduct a joint training session for evaluators for healthcare providers. This has improved regulatory's capacity for assessing technology, leading to faster approvals and broader adaptation for this device. So by balancing this innovation for compliance, key issues could be ensuring that the digital health innovators comply with the regulatory standards requirements and pushing the boundaries for innovation. Consequences for over-stringent regulations can hinder our innovation, while lax standards can compromise patient safety. Some insights could be adopting best practices for global regulatory frameworks can help harmonize standards and streamline this approval process. Building proactive relationships for regulatory bodies through regular communication and collaboration can lead to a more efficient approval process and the development for more relevant and effective regulatory standards. So by addressing these challenges through collaborative capacity building and adaptation of best practices, companies, industry, and healthcare leaders can successfully navigate the complexities, bringing digital health innovations to market. Next slide. So opportunities again. We need to harmonize standards, so to bring easier adopt innovations across multiple countries, reducing our barriers to benefit our cooperation between countries, reduce duplicated efforts, and improve patient access to innovative technologies. Capacity building for regulators. I think investing in training in education for regulatory bodies is crucial to ensure the regulatory bodies are up to date with the latest digital advancements and best practices to improve technology safety and effectiveness. With workshops, I think sharing knowledge, expertise for robust regulatory frameworks, so seminars like this, and getting the key leaders to be involved and to participate is great. And initiatives such as private and public partnerships to foster innovation, collaboration between government agencies, private companies, and non-governmental organizations, get the politics out of it. And then roles like African-specific frameworks like AMRH, or the African Medicines Regulatory Harmonization Overview, fill state registrations and regulations of medicines, including digital health technologies. Impacts on on digital health would be creating unified regulatory frameworks to accelerate adoptions of digital health solutions across Africa. Benefits would be ensuring that digital health products meet high standards of safety and efficacy, enhance regulatory efficiency, and reduces time and cost across product approvals. Again, a case study using the Kenya startup company mobile application for diabetes weight management with the AMRH support. This startup gained regulatory approval more quickly and expanded its reach to several African companies. or countries, which with wider access to this app, it improved diabetic management for patients across the region. So by leveraging these emerging opportunities, African countries can create a more conducive environment for digital health innovation. So these efforts ultimately, again, will lead to improved patient outcomes for these populations, which is ultimately our goal, right? So next slide. And so this leads us, if you want to go to our next slide, thank you, to our role of real world evidence in digital health. And this is a thing I'm a huge proponent to. FDA just released a new guidance for it. I've been using this in 510(k) submissions for years now. FDA has used a few of the submissions I've used real world evidence in to get clearance by. This is by not actually using clinical data, but by using evidence of other studies been done in other countries or other parts of the world to use into your submissions to get clearance. But the definition of real world evidence refers to clinical evidence derived by the analysis of real world evidence. Sources include patient health data collected through digital tools, such as electronic health records or EHRs, mobile health apps, and wearable devices. This importance is it supports regulatory decisions, helps regulatory bodies make informed decisions regarding approvals and monitoring of medical products and technologies. By leveraging the patient data from digital tools, regulators can evaluate the real-world performance and innovations to help ensure that they're safe and effective. This also enhances your post-market surveillance and patient monitoring. Real-world evidence is essential for tracking safety and effectiveness of medical products after they're released into the market. And continuous monitoring also ensures ongoing patient safety and product efficiency, which is vital for maintaining the trust in the healthcare systems. So applications in digital health, it helps validate AI, artificial intelligence algorithms in diverse populations. It provides data in diverse populations by ensuring AI tools are accurate, reliable, and applicable across different demographic groups. This validation is crucial for the deployment of AI algorithms that need to work effectively in various healthcare settings, particularly in Africa, where population diversity is significant. It also helps inform local policy decisions where policy makers can utilize real-world evidence to make data-driven decisions tailored to specific needs of the populations. By analyzing real-world data, policies can be crafted to address local health challenges more effectively and create targeted health programs that resonate with our unique healthcare landscape. Case study insights on real-world integrations. An example would be for digital health platforms, there's been mobile healthcare apps designed to manage chronic diseases, again, such as diabetes. Data collections, these mobile apps help patients collect their data in real time, including blood glucose levels, medical adherence, and life cycles factors. And then they can push it directly to their healthcare providers when they want to, when they need to. The analysis and the impact of this, it allows the patients and the caregivers to adjust the treatment plans real time. Healthcare providers can also observe how the patient is responding to treatments over time and tailor their treatment plans to individual needs, enhancing the personalized care. It can also help them predict healthcare outcomes. Real-world evidence can then help predict potential healthcare outcomes and identify patient risks and complications. A1Cs are also being added in there with their predictive outcomes and proactive interventions to prevent adverse events and ultimately improving patient outcomes. The results by adding this real-world evidence is, and this digital health platform is helping drive innovation in improving healthcare delivery, providing better outcomes. Therefore, this digital health overall is crucial for advancing healthcare innovation, ensuring regulatory compliance, and improving patient care. So leveraging it, I think we can help make better informed decisions and enhance efficacy, efficiency, and safety of digital health technologies, ultimately benefiting patients across Africa. Next slide, please. So again, I believe the benefits of real-world data, it is all data related to patient health safety, delivery of healthcare, routinely collected by various sources. Again, electronic healthcare records are digital versions of the patient's paper charts capturing comprehensive health data, makes it easier access to your providers. Medical claims data, it makes information from billing records to detailed patient diagnosis, treatment, and services at providers' fingertips. Product and disease registries, databases are collected information on specific diseases and products used to treat them. And there's plenty other sources from data wearable devices, patient surveys, and other digital health tools that can provide insights to your patient status. Other benefits for real-world data include clinical trial data. There's complements to traditional trials where real-world data can complement traditional trials by providing insights into how to treat your patients, perform broader, more diverse populations. This is particularly important, I believe, in Africa, where diverse genetic populations and backgrounds, environmental factors can influence treatment outcomes. I also think broader population insights, where traditional trials usually have a strict inclusion criteria, but real-world evidence includes data from everyday clinical settings, which offer a more comprehensive view for treatment effectiveness. For regulatory support, I think accelerating approval processes, real-world evidence can support regulatory submissions, which can help to accelerate the approval process for new therapies and devices. I think real-world impact, regulatory bodies can use real-world evidence to assess real-world impact of medical products, ensuring that they're both safe and effective worldwide for a wider population. And improved patient outcomes, I think identifying patterns and trends by using real-world data. Healthcare providers can identify patterns and trends that lead to better patients' care strategies and outcomes. They can help tailor treatments for data-driven that allows tailoring of treatments to individual patient needs, which will also improve overall outcomes. And it can add to proactive interventions, leading to earlier identification of potential risks and adverse effects, enabling proactive interventions, enhancing patient safety, which will lead to deeper understanding. So by leveraging this real-world evidence, we can gain a deeper understanding of treatment effectiveness and safety in real-world settings, lead to better informed decisions. This knowledge is invaluable for making informed regulatory decisions and driving better health outcomes and impact on healthcare. By integrating this real-world evidence into our system, and ensures that patients receive a more effective and safer treatments that are available. Next slide. So the lessons learned and best practices. I think if we engage our stakeholders earlier in the development of the process, I think it's crucial. This engages our providers, our patients, our local communities, our regulators. It aligns everybody with these digital tools in our local healthcare, and it gives everybody, lets everybody know what our priorities are. It lets everybody know that these are available. By involving stakeholders from the outset and letting everybody know these digital tools are available and they can be tailored to meet the specific needs of the local healthcare system. The alignment ensures that they are relevant and they're effective, and ultimately leads to better health outcomes. For example, incorporating feedback from healthcare providers and the patients, this can lead to a better development of the features that address the real world challenges, improve better user experience. And by us engaging in better transparency and collaboration with the regulators, a key aspect would be, earlier engagement with the regulators helps us understand and comply with the regulatory requirements. And transparency of this communication and collaboration with the regulatory bodies can also facilitate faster approval process, reduce the risk of non-compliance, and ensure that our digital health solutions are safe and effective. Regular updates and feedback sessions also with the regulators can help us address any potential regulatory hurdles early on. Best practices. They include iterative testing and testing of the technologies in real world settings. The importance of this would be conducting iterative testing and pilot studies in the real world setting allows us for identification and resolution of potential issues before full scale implementation. This approach ensures the technology is practical and effective in environments where it will be used. Implementation with small startup pilots of tests and feasibility and functionality of the digital health tool help us collect and analyze feedback to make sure we can make the adjustments and improvements early on. Training of healthcare providers and regulators in digital health tools. The importance of this is providing a comprehensive training that ensures the healthcare providers and regulators are knowledgeable of the digital health tool and we can use them effectively. Training also helps us build trust, and the user build trust with the technology ensures that it can be used to the full potential. A well-trained staff can ensure that it's a better integrated digital tool and that it works into their workflow, improving the overall efficiency and patient care. Implementation, develop a training program and materials that cater to different learning styles and different levels of expertise. Include hands-on training sessions and ongoing support to address any questions or issues or anything else that arise. By prioritizing all these stakeholders early and engaging them and implementing these best practices, I think digital healthcare initiatives can be more effectively aligned with our local needs and regulatory requirements. This approach not only enhances the relevance of effectiveness of digital health tools, but also leads to a greater success and sustainability in improving healthcare outcomes. Next slide. So our conclusion and our call to action. So let's wrap it up and revisit our key points discussed and set the stage for our actionable items and steps moving forward. Our challenge is we need to navigate this evolving regulation and compliance and complexities, especially with the limited resources. It still remains to be a significant hurdle. Solution, we need to, engage with the regulators, ensure transparency, adopt best practices such as iterative testing, continuous training. I think by fostering open communication and collaboration, we can streamline this regulatory process and support innovation. We need to harness opportunities in digital health. Digital health technologies have a huge, vast potential to improve access to care and enhance patient monitoring and significantly reduce healthcare costs. Strategy, again, leverage partnerships. We need to invest in innovative solutions. We need to ensure that technologies are aligned with local healthcare priorities. We need to strategic investments and collaborations that can drive the success and implement the tools. There's this huge importance in real world evidence to drive this digital adoption. Again, the benefits I think are it provides insight and effectiveness and safety in these digital health tools in real world settings. The approach is to use these to support your regulatory submissions and to improve your patient outcomes, tailor the digital health solutions to your local needs. Again, this is data-driven approach. It ensures these solutions are both effective and relevant to the populations they save, and invest in your capacity for building the digital health regulations. So develop training programs for the regulators, for your healthcare providers, build an infrastructure to support digital health initiatives, strengthen regulatory capacity. This can help better manage and integrate digital technologies, and foster cross-country collaboration within Africa. Share best practices and resources among nations, collaborate on regulatory frameworks and standards. There's international cooperation that can enhance the efficiency and reach out digital initiatives, and embrace innovation responsibly. Ensure digital health technologies are safe, effective, and equitable. Engage in community stakeholders in the development process, and practice responsible innovation that'll lead to sustainable and inclusive healthcare. So, thank you. Let's go to the next slide. I think we're almost up with time. There's a little about me. And the next slide is Q&As. If anybody has any questions.
Thank you so much, Carrie.
You're welcome.
You shared very useful and practical insights from the Frontline. And it was great hearing you highlight the importance of stakeholder engagement, engaging with regulators, and also being adaptable in, implementing this digital health initiative. So thank you for that.
You're welcome. Feel free to ask any questions about any aspect of the presentation. Your input and questions are invaluable to foster any.
In the interest of time, we'll take just one question. In practical, so this is from Tosin Ozoya. So she's asking, in practical terms, how does real-world evidence help validate AI? Who will have the responsibility for carrying out the validation process, the regulator or the solution provider?
Can you repeat that?
Okay, so the question is, in practical terms, how does real-world evidence, RWE, help validate AI? Who will have the responsibility for carrying out the validation process? Is it the regulator or the solution provider?
It's the solution provider. So they have to demonstrate, validate, and verify that their solution meets the intended use. So they would have to either have demonstrated it with their proof of concept and or have found other studies out there that have also proved the same intended use. Does that answer your question?
So it depends. You answered Tosin's question properly.
Yeah, so it depends on what the intended use of the AI application is. So with artificial intelligence, there's mental health intended uses, and then there's like it just depends. If there's surgical robots that are out there doing different verification validation for software as a medical device. There's just, she could collaborate a little more.
Okay, thank you for that, Carrie, and thank you so much for joining us today. Your presentation was incredibly insightful. I'm sure our audience gained so much from it. Thank you.
Yeah. They can email me and I'd be happy to answer more.
Okay, great. And if we get any more questions directed to you, we would send them your way as well. Thank you.
Absolutely. Yeah. Thank you. Have a great day.
You too.
Bye.
So we have a panel session coming up after this, where we'll dive deeper into compliance challenges in African healthcare. But before we dive into our panel session, we're going to have a live poll which will appear on the screen shortly. We want to hear your thoughts. We want to just give you the opportunity to share your perspectives on digital health before we move on to the next speaker. Thank you. So I'm just going to start with the first poll question. So if you can see the polls, please engage, and we'd love to get your insights. So the first question says, what is the most significant barrier to the adoption of digital health solutions in rural Africa? You should also see the questions displayed on your screen. Okay, we have some responses coming in. Great. So what is the most significant barrier? What do you think is the most significant barrier to the adoption of digital health solutions in rural Africa? Is it poor internet connectivity? Is it high cost of devices and services? Is it low health literacy rate? Is it resistant to technology adoption? The second question is, which African region is leading in digital health innovation? So when we're done with the poll, then we would get the results from everyone's perspective. So which African region is leading in digital health innovation, in your opinion? Is it West Africa, East Africa, Southern Africa, North Africa, or Central Africa? Okay, we're getting more poll results. Keep engaging. It's a great opportunity to also share what your perspective is on digital health growth in Africa. All the polls are visible on your screen as well. So the third question is, how can Africa's unique cultural diversity be leveraged to enhance digital health solutions? Is it by us creating localized content in multiple languages, having community-driven health programs, integrating traditional medicine practices? We also have another question here. The fourth question, what is the most pressing health issue that digital health could help address in Africa? Is it maternal and child health? Is it communicable diseases, non-communicable diseases, or mental health? So the question again is, what is the most pressing health issue that digital health could help address in Africa? Is it maternal and child health, communicable diseases, non-communicable diseases, or mental health? So after we get the results of this poll today, we would also publish it on our platforms to show what our audience thinks about digital health in Africa and the advancement that we're making. So continue to engage with the poll. All the questions should be displayed on your screen. The fifth question is, what role should African governments play in fostering innovation in digital health? Is it by providing funding and grants for startups, establishing clear and regular and flexible regulatory frameworks, promoting public awareness and education campaigns, or collaborating with international partners? So that's a great question. Keep engaging, get your perspectives in. It's a great opportunity to share your thoughts on digital health and for us to truly understand, a group perspective on how digital health is moving in Africa and how we think it should continue to move going forward. The sixth question is, how well are Africa-based startups positioned to compete globally in digital health innovation? Are Africa-based startups very well positioned, moderately positioned, poorly positioned, or not positioned at all? Thank you, guys. We're getting so many results in the poll. Continue to engage. Thank you. What is the seventh question? What is the biggest data privacy concern related to digital health in Africa? Is it unauthorized access to personal health records, the lack of robust cybersecurity infrastructure, the absence of comprehensive data protection laws, or the misuse of data by third parties? And the eighth and final question in the poll is asking about this conference. How can the conference best contribute to addressing digital health challenges in Africa. Is it by fostering multi-stakeholder dialogues, sharing case studies and success stories, promoting regulatory reform initiatives, or networking opportunities for cross-sector collaboration? So those are all the polls I have for you today. They are still displayed on the screen. You can continue to engage and respond. Our next session after the polls would be our first panel session of the day. And to join the panel session, you're going to have to leave this session and move to the next session. And just a reminder, to join the sessions, you're going to have to go to the conference platform at rectechafrica.dhc.com. Right beside the title of the next session, you're going to see the option to join the session. And it is titled Panel Session 1, Compliance Challenges in African Healthcare, Balancing Innovation and Regulation. So thank you so much for engaging in the poll. We're going to collect the results of the poll and we're going to share them on our social media pages after the conference. Thank you so much. So now please move to the next session and join the first panel session of the day. Again, to join the next sessions, go to rectechafrica.dhc.com, which is the conference platform. Right beside the title of the session, Panel Session 1, Compliance Challenges in African Healthcare, Balancing Innovation and Regulation, you see a button to join. Just simply click the join button and you're on. Thank you. See you in the next session.